Um, Good afternoon, Dr. Kim. Okay, it's afternoon here, so I would say good afternoon, Dr. Kim.
Good morning.
Yeah. Hey, I'm Akim, Abdullah Akim. So it's a pleasure having you here. So
Thank you.
as Mariam said, I think it is right to start now and others can join us soon. So you'll be taking us on acupuncture and what it entails. So
Hey.
what a lot of us really don't know what
Okay.
acupuncture is. Like the word seem vague and we would really like to know what it is.
All right. Well, good morning, all. I know it's afternoon for you. Happy lunch for you. Happy coffee for me. I am happy to speak to you from the bathroom here in Olympia, Washington, which is right outside Seattle. Can you hear me okay? Okay, good, good. First thing I should tell you is it's my pleasure to do this because my chapter of IVSA contributed to my education when I was young as well. And so it's very nice to be able to turn it around and help again. So can you still hear me? Because you guys went black.
Yes, we can hear you.
Yes, we can. We can.
So I will tell you that I started out doing acupuncture after being a regular general practice veterinarian. I graduated in 1997 from a veterinary school here in Washington State. And I didn't get my first certification in acupuncture until 2007. So I did many, many years with just the traditional tools of medicine and did great. After a while, I kind of got a little bit tired of just prescribing medications and anti-inflammatories again and again for the same conditions. And you just start to look for something more. And, you know, of course, some of these dogs and cats can't take these medications. So you need to have another alternative approach. Particularly in my neck of the woods, we have really chubby dachshunds who jump off the couch or working dogs who jump off a tractor. And then, of course, cats who think they're superwoman and can jump off refrigerators. And they all get hurt and they all need help. After, again, many years, I decided to go back to acupuncture school. And in the United States, you can actually go to veterinary school and then also go to a veterinary acupuncture continuing education, which is what I did. I felt the need to start with a very science background because I'm pretty science oriented. And the concept of using very tiny needles in select spots like acupuncture as a concept in the Chinese paradigm of medicine was a little hard. Instead, I was able to think of it more as a science matrix. Like I could put this needle in this spot because the lymphatic system is strong here, or because there's a branch of the sciatic nerve here. So that was easier for me to envision. I went to school in Colorado, and that acupuncture class is very, very scientific. And I did that for a few years as well. And so let me just stop there and tell you that first training was science-based acupuncture. My next bit of training is all very Eastern, very traditional Chinese medicine training. And we'll just start with what acupuncture is because I understand it's new to a lot of folks. Here is a little package of needles. Let me figure out where my camera is. It's going to be kind of hard to see it. So I'm going to open this little package. They're very, very small needles. They're not quite painless, but they certainly are not, these are not 20 gauge needles or anything. I don't even think you can see can you see that flexible needle is? And you can see that it's very malleable. It's very small. You see how small that is? So that needle is just an example of one of many different kinds that you can buy. And then For me, acupuncture is easily explained by the concept of science. We know that in our body, we have different areas that have large vascular support, lots of blood vessels go there, or there's lacunae of lymphatic structures, they live there. We know that at the very bottom of our toes and our fingernails, those are the end point from nerves. So if we try to think of it in science, sometimes it's easier. We know that if we hit blood vessels in certain areas, then we're going to cause a reaction by the body. We might improve blood flow. We might change the nerves. We might decrease substance P transmission, so there's not as much pain happening. There's all different kinds of ways to make that happen. And initially, I did that from the science base. So, we could go to the Qi Institute, which is a traditional Chinese medicine institute with a base here in Florida, United States. You can do that online, or you can do that in person nowadays with the development of COVID and more Zoom learning. And in that training opportunity, you get a very Chinese matrix. So you get to learn the same meridians that run through the body. They've been used by the and help to neutralize some of that excess. Or if you have, let's say you have a dog who jumped off the bed and paralyzed back end and dragged behind them, you can that helps. The idea behind acupuncture is that you bring an input to that body energy balance or the energy distribution. Meridians are pathways for energy or chi or life force, depending on what you want to call it. And if you tap, say, right here between the eyebrows, that's a very, very powerful point. And I use that sometimes just to calm puppies down in their exam rooms so that I can actually have a chance to talk to people. Or they might have, they might be an old dog who has seizure disorder. So I might use certain points to help calm them down while I'm trying to work through the information with my clients. So here in America, there's 3 different ways of getting trained. There's very science, there's very Eastern, and then there's a middle ground, kind of an Eastern Western blend. And because I'm a little hard-headed sometimes, I had to take all 3 of those class approaches to get the true understanding of where we're at. So those are my opportunities for training. And now here I am able to mentor other students through their acupuncture training classes because I've been doing it for a very long time now. And I get good approach, good response to therapy. We get dogs to walk again. I get allergies to be under control, seizures to not be as extreme. So I think maybe the next opportunity for me would be to tell you, how do we do that? How do I take that information and actually put it in action? So, for example, I might get a 50-pound Labrador who plays too hard. He has hip dysplasia. He can't walk around because he hurts too much. I might grab for all of my traditional medications. I might use an anti-inflammatory. I might use gentle massage and tell him to be quiet and use glucosamine and do all those things. And then I might also grab for my needles and put specific needles on their body to help them have less pain in the back end and help them be able to go through full range of motion and flexion on those legs. A really common cause of pain is just truly trigger points. I think of them as like Charlie horses or knots that you'll get in your muscle or your fascia. Acupuncture is excellent at getting rid of those things. And they work really well in combination with Western drugs, or you can use them in isolation. It just truly depends on your patient and what their needs need to be. So, and also in my neck of the woods, and I'm certain in yours, what their owners want them to do or what they can afford to do. Finances are important in all quadrants of the world, and it's important to not judge people for what they can and cannot do financially. And so acupuncture can be a really inexpensive approach, whereas sometimes medications are more expensive and not able to do. So it's important to know that we have options, and that's really what I was seeking when I went to acupuncture training was more options on how to treat pain and disease that had other ways that I could help them. So I wanted to make sure that we knew that there was multiple ways of getting trained through the process. And then in reality, I want to tell you what we really do here in my community, which is a relatively large city. There is probably 5 veterinary acupuncturists in my neck of the woods. So within 50 miles either way, I might hit 5 different veterinarians who are doing acupuncture. Some are doing it in their small animal practice, so they may do only acupuncture once or twice a week or even less. Others, like myself, that is my primary job. That's what I do, is just acupuncture. Recently, I retired from general practice after almost 25 years of doing, your spays and neuters and ear infections and skin diseases and things like that. And now I do 2 things. One thing is that half of the month, so about 8 to 12 days a month, I do just acupuncture and herbs and massage work. That's a great heartwarming thing to do. I can help these dogs feel less pain as they get older or recover from an injury. If they tear their ACL, for example, or hurt their neck, I can help them to get back to jobs or get back to their life and enjoying their families. And then the other half of the time, I do something completely different, which is, and we call it relief work or locum work. Excuse me, where I'll go in and help other veterinarians do their daily jobs so they can take a vacation. Excuse me. So in my acupuncture practice, it's really just acupuncture and herbs. I get to have the opportunity to have a primary caregiver do their regular management, and then they come to me and just get that service done. You might wonder financially, what does that cost and how does that look? Here, my training costs about, with travel and hotel stays and airlines and things like that, each certification was probably between about $7,000 and $10,000. Some of the remote work that we can be doing now makes that a lot less expensive because we don't need to travel 5 times to Florida from Washington State. But it's still a significant financial investment, even for myself or other, United States practitioners. Medicine is expensive to learn, and therefore you need to compensate and get to pay off those educational loans and support your family or have a life. So here it is, typically acupuncture treatments are about $75 up to $100, depending on who's doing it per treatment. Excuse me, my nose is running. So it's not a cheap service. Therefore you get a select set of clientele who can afford that. So that's kind of, and also these little packets of needles are super duper cheap. I can buy a box with maybe 500 needles in it for $8. So not expensive to do the work, just expensive to get the training. Okay, and then you might wonder what kind of patients do we do it on? The clear one that we all think of are your pain and injury dogs. So your dogs that have bad hips, your dogs that have knee injuries, those who have broken a limb or have fallen down and have hurt their spine. Those are definitely, you know, the most common patients that we treat, the bread and butter of the work. But we can also treat things like seizures. I can treat skin allergies, anxiety, depression, grief. All of those more emotional things are called Shen disturbances. And we can have applications for those guys as well. And then once you start heading down the acupuncture line, it's a little bit like opening an entire new world of medications or services. So I can do food therapy now, when we can think about how food engages in an energy perspective. So is it a hot food? Is it a cold food? Do I have a little tiny dog who's just a fiery child and he's barks all the time and he's energetic as heck and has to keep moving? And you know, how do we help him with his anxiety or his overstimulation? Dogs who have food allergies, how can we help them through that? There's also massage work. So there's Chinese massage, which is called Tui Na. And then there's your more traditional medical massage. So that's another avenue you can go down. There's definitely Chinese herbs, and then there's more of your traditional or Western herbs. So you might think of things like echinacea or kapa kava or milk thistle versus a Chinese protocol, which might be a mixture of more of your traditional Chinese herbs. Those approaches are good too. So it really is just a window that opens once you open your mind in looking for alternative ways, or if you already are open and you want to explore those windows, those are great. I think it's important to note that everything relies on your anatomy. So even though it's a 3,000-year-old process, and they may not have known where those nerve roots run or that artery or the nervous innervation goes, they learned it and they didn't know particularly what they were accessing, but we know now because they've done a lot of electron microscopy work where they've put the needle in and then watched it on a monitor and seen if you put your needle here, what happens on a cellular level in that area. And we can see it go and activate that nervous system and bring input up to the brain. So now we have the science and the technology to track what the traditional Eastern therapists were doing. And certainly it helps my science brain, and it also helps my Eastern brain because I can see what I'm doing and see how it's impacting. And I don't have to rely as much on just faith, right? So don't forget the anatomy of the dog. That's extremely important. Chinese medicine, you know, is built on the concept of qi and yin and yang and blood flow or energy. So you can even do things like do nutrition through the concept of yin and yang. And then this is just a subset. This is a really awesome little journal. These are a few of them that I have here. This is the Integrative Veterinary Care, and you'll see that this one happens to be talking about integrative management of the neurology conditions, which I must say is kind of my favorite thing to work on, which, trust me, when I was in vet school in 1990s and 97 when I graduated, I did not think I was going to be a good neurologist. That's a complex study, but acupuncture requires that you start to get it. And so I did. And here's where we might do rehab. That's your underwater treadmill, which is actually where I work now, is a facility that has underwater treadmill, massage therapist, exercise balls, physiotherapy, muscle development. We track progress through the use of e-stim and can you feel this? And then I also will use electrical units to kind of push energy through or push stimulation through barriers so that now I can get their neck to work again. So there's that concept. And then this is your book, all the acupuncture sites that they have documented in the body. And this was actually written by Dr. Shea, and he is the chieftain here in America for, he's a 5th generation Chinese, trained here in America. So I've got 5th generation Chinese acupuncturist and herbalist, has come to America, gone through the veterinary school here in Florida, and is able to really integrate those two studies together. And he's the chieftain. And so he writes a lot of really good books. And this book is all different acupuncture sites. So, you know, bladder 16, the name of the point in a Western way. Jushu is the name of the point in the Chinese way. You know, where it is exactly and what I might use it for. So this is an entire book about that. The last book I'll show you is what I think of as my very first line resource. If you can see that, Practical Guide to Traditional Chinese Veterinary Medicine. Again, written by Dr. Shea. But this book will take it apart for me. It'll say, for example, do you have degenerative myelopathy? So you have an innervation issue in the hind end of dogs. How will I look at that from an Eastern perspective? How will I see that from a Western perspective? In an Eastern perspective, what are my best acupuncture sites to pick? What are my best herbal supports to pick? So it's a pretty comprehensive approach to that. I don't want to forget the fact that we do still have science. This is the Journal of American Veterinary Medical Association. This is not an acupuncture book. This is where I would go to for my science and my Western-based treatment and diagnosis and information. And then I will need to convert that over into an Eastern paradigm. So that's kind of how that works. And these are real dogs with real problems that I really have actually been able to have them drag their booty in and not be able to stand up and walk. And then, you know, be able to stand up and walk and leave the building that same day. That's always a miracle. And we cheer very loudly and we're very happy when that happens. And I can maybe get them to stand, but they don't walk very good, or their seizures are more controlled, but they still have a seizure disorder, right? So, so there's importance to have that idea as well. I think that I was supposed to talk for about 30 minutes, and I just need somebody to point out if I'm on target or not with that, because I'm also ready to answer questions. If there's anybody that can tell me if we're on time.
We have like 10 minutes left, so you can still go on.
Okay. 10 minutes to talk or 10 minutes before questions, or should we do questions?
10 minutes.
Hi, so sorry.
Great.
Let me just
So
let me cut in. Sorry. Okay, so I don't know if you still have like a lot of things to tell us, but we're kind of like using this basic accounts because we don't have a premium account. So the meeting is going to kind of like end in the next 7 minutes. And if it does, you can just click on the link and join back. Yeah.
okay.
But you have like, I think 15 minutes for you to round up. So let's say 5 minutes more to talk and 10 minutes for question and answer. Is that okay?
That's great. That's great.
Thank you. Thank you.
Yeah, but so I think in those last couple minutes, maybe we would want to think about a specific patient, maybe give you a case example of somebody like that, or and we can do this in question and answer time. We can also talk about the reality of how do you get that training and that kind of thing. And then also I should tell you that I have been lucky enough to do a lot of traveling in my life. So I've been to Western Africa, Eastern Africa, and Southern Africa, and then also a lot of European countries and across America. So I know that there's some excellent acupuncturists in all parts of the world. And although we are not practicing on humans, because in my neck of the woods, that's not legal for me to do work on humans. You know, if we talk to human acupuncturists, they have really good information as well. But we have to remember that we are bipeds and our animals are quadrupeds. So how we carry our body mechanics are different, and where they may put a point in human field is different from where we neurologically or structurally may place the point. For example, Ba Wei is this point right here at the very top of your head. That's because you're closest to the sun. But in dogs and cats and cows and horses, Ba Wei is actually at the lumbosacral point. So it's just a different location, same name. So it's kind of important that we are looking at that neuroanatomically as well. Where is that point before we just go treating it? And then I also wanted to point out that there's some straightforward, simple things we can do with acupuncture that doesn't have to get people who don't believe in acupuncture. We can be doing some things to help those patients by use of acupressure. So right between the ears, from the top of the ear to the bottom of the ear, there's that little kind of groove behind there. That point is called On Shen. It's a Chinese point for calming your mind and helping us to be more centered. So I often will do a lot of massage work, and I start from the front of the brain. I work up over the governing vessel. That's where your massage points or your governing vessel meridian runs. So I'll massage these dogs from here up over their heads, back to behind their ears, and then I'll run my hands out. It's just a massage technique. Dogs don't even know what's going on. People don't care that you're touching their dog in the head, and you've helped them to be less anxious in an exam room. And then they also like you better, which makes everything go better. Or have heard about that actually your 4 stands for large intestine, 4 being the number of the spot. In humans, we think of that as a headache point. A lot of people will hold their hands here when they have headaches. It's actually the master point for the front of the face. So we'll use this if they get a lot of allergies, if they get nosebleeds, if my dogs have a lot of redness from the eyes, if their mouth aches. This is a good point. And I can just hold them by where their dew claw is and let that happen without anybody getting frustrated. And a lot of dogs do not like needles in their feet, but they'll tolerate it if you try to just hold it. So there really is some applications that are easy, that don't take a lot of training, and then there's some and let me think. I think I talk a lot, so I hope I've covered kind of the basics, knowing that there's many meridians on the body. They all have very specific points that you have to learn, and your acupuncture point may be 2 millimeters wide. So, you know, if your fingers aren't smart and finding those points or finding the exact site, if it's over here a little bit too far, you missed it. You didn't do anything. You actually don't have an acupuncture point. This is where the acupuncture point, not here. So that's accuracy is one of the most important things here. So, okay, good. I can see I saw one question come up there. I see the question that says, does acupuncture have side effects? You know, acupuncture by itself, you know, it's powerful. So I haven't actually had a lot of negative side effects. What I have had is these dogs who are in a lot of pain, they'll come in, I'll give them acupuncture, they'll go home, and they'll sleep for 24 hours. Now, if I forget to warn people, that could happen. Yesterday, is that okay? And all I can tell him is he must be sleeping really well. You know, he must be without pain, and it's his first relaxation. If I do accidentally, let's say that you put a needle someplace and you hit the nerve, which would be really kind of hard to do, but let's say you do that, that can hurt. and they might get sore there. Or if you ask them to put their leg out to the side, and that's an uncomfortable posture, they might be more uncomfortable. Side effect, not so much. Yeah. I see another question that says, does acupuncture, does it cause pain? It can. And there are points on our body that are more sensitive than others. Often the first time I do a dog or a cat, I will pick easy points, points that will allow the patient to experience what I'm doing. I'm going to put a really, really small, like tiny gauge needle in, and they might go, well, that was kind of weird, but it didn't hurt, and I'll let you do it. And so I might stick with easy points that don't hurt before I go for the more sensitive points, like anything on their feet. That can be a fast way to getting them to say, no, you can't touch me. Mostly things around elbows, like in really badly arthritic elbows, those are hard. They might be uncomfortable when I do that, but usually not. And I must admit that we do a lot of fear-free here. So I use a lot of treats and snacks and food